Hey everyone, it's Dr. Ty at East Valley Chiropractic. I got a special guest here with me today. This is Dr. Beth from Achieve Health and Wellness. Dr. Beth is a physical therapist, and so for the month of June, we are partnering up with Achieve Health and Wellness and really talking about how we can collaborate to help better serve our patients as well as their patients, and kind of what we do and what they do and how that all complements. And so, Dr. Beth, thank you so much for being here. Tell me just a little bit about what you specifically do at Achieve Health and Wellness. I know you guys have kind of a niche market or a little bit of a unique clientele that you serve that kind of separates you from a kind of quote unquote normal PT. Is that correct? Okay.
Yep. So at Achieve Health and Wellness, we do see clients of all ages and with all diagnoses. However, what we really specialize in is individuals with neurological disorders such as like cerebral palsy, Down syndrome, post-stroke for adults, or like paraplegics.
Okay.
We have a really specialized intensive therapy program, both for PT and occupational therapy, where we work. For PT, we work with the kids or adults for 2 to 3 hours a day, 5 days a week for 3 or more weeks at a time. So we typically see about 3 months of progress in a 3-week period.
Wow, that's awesome.
Yeah.
And that's very cool because a lot of times I get this question in the office from some of the practice members that I see is, should I see a chiropractor or should I see a physical therapist? Or I get that question too with like a massage therapist. And the example or the thing that I kind of explain is it's kind of like asking, well, what came first, the chicken or the egg? A lot of people think that you have to choose one over the other. And a lot of times they actually work really well when you are doing both.
Yeah.
But with what Dr. Beth was talking about as far as kind of that niche market that she sees with, post-stroke and a lot of neurological based conditions and behaviors and things like that, chiropractic helps along with that too. The way I kind of explain it, when we see kids with like ADD, ADHD, autism, sensory processing disorders, some of those spectrum disorders is there is a very important neurological component to it. And I kind of always explain to parents that when there is a kiddo that has a neurological disorder, it's like they're driving a Ferrari with bicycle brakes. There's that organization or that organizational aspect in their brain. Or another example I use is like they're in an elevator listening to Metallica rather than calm elevator music. And so that's awesome that you spend and you can see that much progress in a 3-month progress in such a short time frame. And so the big thing too, as far as us collaborating, how do you see, with what you do and how that can complement us, vice versa? How can what we do and who we see complement with you, what you guys do?
Yeah. Well, specifically during like an intensive model, our clients who have chiropractic care during that course, they typically have less muscle soreness. I don't have to spend quite as much time doing like massage to loosen them up before starting. We can really do a little bit of active stretching and warm up and then really get into the more challenging activities.
Right.
So that we're able to push them harder and get more functional mobility and activity out of them.
Right. So it sounds like from what I heard from you is you've seen with the patients that you work with that receive chiropractic care kind of almost start a couple of steps ahead of those who don't, because they've already kind of had that groundwork set, so to say, where you can really dive into the intensive stuff right away, as opposed to doing some of the basic stuff before you get to that intensive stuff. That's awesome. No, and the big thing that we want to do is, just allow you guys or have multiple resources for you. So I know we do have some parents here that have some kiddos at home that would obviously benefit from your services. And so we want to make sure that you guys are aware of who Dr. Beth is, what they do at Achieve Health and Wellness, and how that can benefit the care that you're getting here or benefit your family members or friends that you have at home that are maybe looking for answers. Because a lot of times, we hear that too, which I'm sure you've heard, is we wish we would have heard about you sooner, right? You always hear those comments. And so that's our big thing, is just giving you guys resources, partnering with awesome, other businesses in the community, health care providers, and how they can benefit you guys, like I said, your friends and your family. So, Dr. Beth, do you have anything else before we jump off here?
I don't think so.
All right. If you guys have any questions, feel free to reach out to Dr. Beth at Achieve Health and Wellness. Reach out to me. We'll make sure to get you guys all the information that you need to answer any questions that you may have. Thank you guys so much.